Now what I'd like to do is open up for questions to anyone, any of our panelists, or to any members of our trauma team. And I think since the mics are here, maybe we better, when we answer the questions, step up to the mic so it can be recorded. So we're open to any questions and answers from the floor, or any of the press may have.
Can you tell us how long these services have been in place? I realize the certification just happened, but you've had these in place for some time, is that not right?
You know, we really have, and I'm going to ask Dr. Winnie to expand on that a little bit, but just we've been really becoming a level 2 trauma probably over the last 20 years. And it's been very intensive over the last 5 years, because you can't just have part-time neurosurgical services or part-time trauma. We really have had to be able to, as Dr. Winnie said, be geared up in the number of specialists and diversity of services 24/7, 365 days a year. And so it's really become intensive. Dr. Rob Winnie and Dr. Glenn Milos over the last couple of years have really come forth and helped to step up the big last pieces of achieving this accreditation. And Dr. Winnie, maybe you want to make some comments on that.
Thank you. And I'll have to ask you, how long has the training center been around? It's been more than 18 years?
Probably 1920.
19-20 years for the pre-hospital portion of it. And as Mr. Bay said, we've been increasing the capabilities here over the last few years. We've had a fully staffed trauma service starting last December. So that is
December of 08.
of 08. So,
You might define a little bit what fully staffed means, have enough
Oh,
trauma surgeons.
sorry, a fully staffed trauma service. That includes trauma surgeons who are available to respond to the initial trauma patient with backup general surgeons, and again, the fully staffed orthopedic, neurosurgical, cardiothoracic, 24/7, 365.
Mr. Bay, you mentioned all the resources you guys have been pumping into this, something about $5 million. How are you going to pay for all that?
I think Dr. Winnie probably, he has the statistics, but I think he mentioned to you that both our trauma admissions as well as our trauma services are up. Dr. Winnie, you have the statistics, but 114 to over 200%. So it's really being able to provide, the key is being able to provide the care to people close to home. Obviously in major trauma, time is of the essence. And so you're saving lives, decreasing morbidity if you can get the full trauma services to an individual quickly. And I think when you take a moment to look at the map, if I were someone living south of La Crosse, other than trying to get into UW, I would be asking myself, why am I living in an entire southern part of the state where there is no level 2 trauma, whereas if I'm north of La Crosse, I've got access to actually 7 level 2 traumas. And so just in terms of the kind of accidents that happen in everyday life, the quicker I can get to fully staffed 24-hour trauma services that have all the right technology, it can mean a matter of life or death for a loved one.
That time, I'm going to explain the difference between having to transfer somebody out and have the time to take them to another facility versus being able to be treated here.
Yeah, I think I would turn that over to the specialist. Did you get the question, Dr. Winnie? Or Glenn? Maybe Glenn, you should respond to that one. Dr. Milos, if you could. He wants to know why the difference of helping to save lives by getting access to a level 2 trauma, fully staffed service in less time than having to be transferred somewhere.
Well, as Dr. Winnie alluded to, that with any major trauma, time is of the essence, and being able to provide the services that we're able to provide those trauma patients are life-saving. A patient that presents hemorrhaging, severely hypotensive is in need of imminent trauma care. That's what we can provide here. If we did not provide the services that we provide here, it's quite likely or possible that these patients that need to be transferred would not make it to their final destination. So it's the services and the resources that we have here that we're able to provide, not only our community members, but our surrounding members, that really enable us to save lives because they are in such critical states. And hopefully that answers your question.
Could you repeat those statistics again, Dr. Winnie?
Our trauma volume, which is the total number of trauma patients we see, is up 82%. Our critical trauma patient volume, which are those in the most urgent need of care, is up 141%. Trauma patients requiring admission to our hospital is up 82%. Transfers into our institution by ground or by air are up 214%. And transfers out of our hospital to a higher level of care are down 48%.
And that's from when?
That is this year
Yes.
compared to the year previously.
Okay, I'll wait till.
Correct.
Do you have an approximation, maybe actually the numbers of what that is, say from like 200 up to 400 or something?
I
Or
think
just,
in terms of
you know,
numbers.
Oh,
8 cents?
I just brought the percentages today. I don't have the numbers. I apologize.
No, that's fine.
Can we get those?
Yes.